we know that, you know, many people would prefer to die at home that aren't enabled to at the moment, and one of the issues I think is that pain management is not adequately controlled or successfully managed at home, and that sometimes leads to patients being admitted unnecessarily. So what we're hoping is that if we develop and evaluate an intervention that does work, carers will be enabled or empowered to manage pain better in the home. What we're seeing is that more people are taking on that caring role in the community to care for their relatives, their parents or their spouse at home, and that involves a great range of tasks, and one of those is managing pain medicines. So, and what we're seeing is that it's the carer that's with the patient all the time, it's not necessarily the healthcare professional, so they need to be constantly able to monitor symptoms, to think about when pain control might not be working or when medicines need to change. Through looking at the literature, we've found that there are a lot of needs, concerns, lack of information that carers have about medicines, their beliefs about medicines, uncertainties about managing injections or strong opioids, for example. So there's a great need there to do some work with carers to help them manage pain and medicines better at home, and what we hope is that that will contribute to their feelings of well-being, will reduce the strain on them. We also hope, obviously, that it will contribute to better management of pain in the home setting, and we hope that that will be obviously a better experience for the patient at the end of life, and might also contribute to them staying at home to die at the end of life if that's their wish. Certainly what we've seen from the literature that we've looked at so far is that carers have concerns about issues around whether medicines are addictive, whether in fact administering pain medicines might hasten death. We've heard today a little bit about carers' concerns about pain medicines causing drowsiness and issues around losing their loved one if there's a perceived over-medication. And there's also issues around being able to distinguish between when there's too much pain medicine given, how to recognise when symptoms break through. So there's a whole cluster of issues around fears and concerns about using particularly strong opioid medications, as well as a literature around the side effects of pain medicines and how to manage those, issues like constipation and nausea. Whilst there's been a lot of work to identify what the concerns, the beliefs are, what the information needs are, there's actually been very little that has introduced or evaluated what we're calling an intervention for carers. So what we're hoping to do is develop something that actually makes a difference to them, and to actually engage the nurses who are delivering care in the community to patients and their families to actually work with the carers. So what we'd like to think is that if our intervention is successful, that it's something that might be rolled out into practice, something that nurses can work with to help carers take a more active role in medicines management at home. So what we're hoping to do in the first phase of the research is actually to work with carers and work with healthcare professionals and with patients to actually start to understand what is it they need in practice to be able to manage pain medicines better, because we don't know that at the moment. So we want to hear from nurses and from carers about what are the things that would make a difference to practice. And so what we hope in the second phase of the research is that we've developed a package that will work, that nurses can deliver in routine practice. It's not something that's done by a specialist or by a researcher who then goes away, but it's something that nurses will be able to integrate into their daily practice to help carers better manage medicines.